To bisect the calcaneus, you want to push that fat pad out of the way plantarly, or the plantar fat pad, so that you can really get on the bony borders of the plantar surface of that calcaneus. With the middle phalanx, see, I'm trying to get on the medial and lateral borders of the calcaneus so that I can properly represent that trapezoidal bone. Notice that it's wider distally than it is proximally. And then you're going to want to bisect that with at least 3 dots and use a best fit line. Try not to do this by hand. Use a goniometer to actually draw this line, unlike I do in the video. Notice that I'm using a marker here so it's a little bit easier to show up in the video, but a standard ballpoint pen should work just fine. Moving on to the bisection of the lower leg. First, we're going to factor in any external or internal tibial torsion here so that roughly this line is on the most superior aspect of the leg, considering that we want the ankle to dorsiflex roughly in line with this tibial bisection. So notice that I'm palpating the fibula and tibia medially and laterally, trying to ignore any soft tissue. Squeeze into the bone, try to center that. Notice that dot was a little off center, but I'm going to go back and double check. Just making sure it's roughly at the top of the leg. It's not off to the medial or lateral side of the leg. So just going to correct that bisection there. All right, draw the best fit line and understand that this is just an estimate and that reliability and validity of calcaneal and tibial bisection is limited. As an alternative to the posterior alignment method, the anterior alignment method has some benefits. It's easier to find the bisection of the distal third of the tibia because the tibial crest is more prominent anteriorly. Additionally, we can see the function of the talus much easier here, in particular the talar head. And the midfoot and forefoot are represented in this alignment technique. So we get a bit broader perspective of the foot. Now see here in this image, the talus articulates with the navicular, and the navicular articulates distally with the cuneiforms, the 3 of them. And the center cuneiform, or the intermediate cuneiform, articulates distally with the second metatarsal. Therefore, the second metatarsal line, which we're about to draw, serves as a rough representation of the axis of rotation that's going to occur through the midfoot and forefoot. Now here in this video, we first start with finding the center talus. So you find the soft spot medially here, make a dot, and then find the soft spot laterally, which is essentially the sinus tarsi. Now onto the talar head. So if you put a dot in the center of the medial and lateral soft spots, that should represent roughly the center of the talar head. Now draw a line along the second metatarsal shaft through the midfoot to represent the mid and forefoot. Now we're going to bisect the lower leg, the distal third, by using the medial border of the tibia. Being sure not to mistake the extensor hallucis longus tendon for the edge of the tibia. Okay. Now here's what the foot would look like in a maximally pronated position. Here an open chain. And this is maximally supinated, also in the open chain. This is a picture of someone in resting stance. And of course this is just a rough estimate of foot posture. But remember, the main goal is to determine if the foot is functioning at in range, when it is at in range, and how long perhaps it's in range, which can be estimated with video analysis. This may help with exercise prescription, orthotics prescription, taping even. And the patient can go home with this and use this as a tool to practice aligning their own foot in a mirror.